Our next champion in global health is Dr. Joachim Sackey. Sackey was born and raised in Accra, Ghana, where he received a bachelor's degree in nutrition and food science and a master's degree in dietetics at the University of Ghana. He came to the U.S. in 2012, where he pursued another master's degree and a PhD in nutritional epidemiology at the Friedman School of Nutritional Science and Policy at Tufts University in Boston, Massachusetts, before joining Rutgers in late 2017. His deep personal understanding of food insecurity began during his childhood in Ghana. There were times when his family had no money or food, and his parents had to take a short-term loan or borrow groceries from neighbors to feed them. These periods taught him profound lessons in resourcefulness and resilience, including having to forage and eat almost anything available. His experience with food insecurity resurfaced when he moved to the U.S. for his PhD at Tufts. As an international student with a wife who could not work and a baby, his family relied heavily on finding the best deals, often visiting multiple grocery stores and discount sections just to make sure they had all they needed. The cumulative experiences, from his childhood in Ghana to his time as a student in the U.S., formed the foundation of his passion and advocacy. They ultimately led him to establishing the Rutgers Health Food Pantry on campus after joining Rutgers, highlighting that food insecurity is a widespread issue that also affects students, staff, and faculty in our own community. Since 2021, he has helped lead initiatives that have distributed over 500,000 pounds of food and supported more than 27,000 client visits. His efforts encompass grant writing, data analysis, outreach, and transitioning their operations into a more effective digital platform. He has also mentored students conducting research on food insecurity's impact on academic performance and mental health.
Sackey's scholarship broadly explores the intersections of food insecurity, health equity, and lived experience, both in local communities and global contexts. He has contributed to peer-reviewed publications and conference presentations examining how food insecurity affects vulnerable populations, including Rutgers' own students and individuals living with HIV, and how culturally responsive interventions can promote resilience. In collaboration with Dr. Diana Finkel and the North Jersey Community Research Initiative, Sackey has conducted projects exploring food insecurity and resilience among transgendered individuals living with HIV in Newark. I have had the personal pleasure of working closely with Sackey on global nutrition research in Senegal, examining infants and young child feeding practices and the role of food environments in supporting those practices. His global health impact also extends to education. Together with Dr. Riva Tugger-Decker, he supported the University of Dodoma in Tanzania in launching the nation's first clinical dietetics program and helped benchmark their curriculum against international standards and strengthen both didactic and clinical curricula. Saki truly believes that global health is not a distant concept, but a local reality, as many of the health equity challenges faced abroad also exist within our own communities. Through his role at Rutgers Health and as a core faculty member of the Rutgers Global Health Institute, he strives to bridge local and global efforts, ensuring that lessons learned across borders inform solutions everywhere.